The yeas are 220, the nays are 215. The bill is passed.
Certainly the notion of government being the sole authority, dictating medical procedures, dictating what services must be covered, trying to micromanage what is now 18 or more % of our entire economy is a prescription for both financial failure and eventually medical failure. I was so disappointed that it didn't reform anything. I think it's a misnomer to call it reform. It kept the forms of healthcare we have that make it cost too much and deliver too little quality, and just makes them worse. So, making healthcare appear to be free through the third-party reimbursement system, the worst one we have, with government doing the reimbursing and the controlling. When you got a supplier who gets paid more by doing more and a customer who feels no particular expense from more being done, you got a formula for overconsumption and overspending. And behind all this, you've got this legal malpractice industry, which has built enormous excess through defensive medicine. Ask anybody in healthcare, ask any physician in America, there isn't any question. It's a very large factor, and we should be acting to take it out. So all those things are perpetuated or even magnified now as you're going to subsidize tens of millions of more people into this failed system. Those systems that apparently some people in the administration admire so much are under incredible pressure. People are fleeing the systems for private care or augmenting it with private insurance, I should say. You know, people in America, I don't think, will sit placidly by while loved ones suffer or perish in the queue, as they say in Europe. So, if you set out to model your healthcare system after someone else's, I think they picked the wrong prototype. We created a program called the Healthy Indiana Plan for low-income, uninsured people. It amounts to HSAs for poor people. We called it the Power Account. It's an acronym I thought up in the shower one morning, only place I get good ideas. So Personal Wellness and Responsibility Account. And what we're finding out is that, first of all, low-income people are just as capable as anybody else of making wise decisions when it's their own money that they're spending. And they're also they're acting more like good consumers. They're visiting emergency rooms less, they're using more generic drugs, they're asking for second opinions, and some real money's starting to accumulate in their accounts. There's obviously real sentiment in the country for repealing this bill, for the colossal mistake that it was, and replacing it, I would hope, with a new a set of changes that trust the American people and empower them to make more of their own health care choices. The administration believed, I guess, that if they just jammed this thing through, I remember Speaker Pelosi at one point said, "You don't have to understand it, there'll be time for that later." Well, they seem to believe that people would come to love it. But the further we go, the worse it gets, the worse it looks. We learn more and more about more cost, about more loss of choice, about higher, not lower premium. My successors are likely to have a very large problem on their hands if nothing changes.